Dr. Chen. When I get sick, I go see a doctor. They give me some prescription medicine, and then I feel better. Does the same thing work for therapy? I feel sad, I feel unhappy, I have a problem to solve, I go to see you, then bam, you solve the problem. Is that how it works?
Honestly, I wish. Sometimes it can work like that. It really depends on why you're coming to therapy again. If it's a specific issue, like you want help in working how to speak in public, then yes, after a few sessions, it's very focused, you'll get better suggestions on how to do your project, and then you can move on. But the process of therapy in itself is usually a more long term. And how it starts out is, first you have something called a consultation. You go in, you meet the therapist for the first time. Usually it's about 1 to 3 sessions. And you talk with the therapist about your family history, why you've come. And you can ask the therapist questions like, what's their education, if they can help you, how does therapy work? Because everyone works a different way based on the individual. So after you determine that, he'll decide together if it's an appropriate fit between the patient and you, and if not, they'll refer you to other services. Now, as for working, like what therapy feels like and what therapy is like, that's kind of an individual thing, but I kind of can describe how I work with people. So therapy, working with me, is more about the relationship. What I mean by that is me getting to know you, me getting to understand how you work, how come you get into the same problems you do in your life, and how come it keeps happening over and over again. The way that usually works is the problems that you have on the outside come to me on the inside, because we have a relationship. And I'll get to see how you interact with me, and I'll point out what is different and what you're doing to cause you to have problems in your relationship. And then you can decide whether you want to change and also where it comes from. Usually how we learn to behave with people and the problems that we get are things we learned from the past. And that gets played out with me and also prevents people from moving forward in the future. So really therapy is about learning to express yourself both behaviorally and emotionally, and to feel and to accept what you do. Take more responsibility for who you are. Have a little more control instead of always wondering, how come I'm always having problems? And become less of a victim. And what I talk to patients a lot is, you know how when you're in a car, you can either be a passenger or you can be a driver. So we help you, well, I'll help you get into the driver's seat.
I see. Many Chinese, they are very well educated. And some of them have PhDs. And they are very rational and they have good self-control. You think that they may not be on the driver's seat sometimes? And they would still need your help to move them from the passenger's seat to the driver's seat?
Again, that's a great question. Listen, I believe if you're already in the quote-unquote driver's seat, again, you're going to be coming to me. But there's a difference between intellectual knowledge and emotional knowledge. I think a lot of people have intellectual knowledge. And that actually helps to keep you doing things the way you do. And again, a lot of times you know you're doing the wrong thing, but you still do them. Because it feels good. For example, alcoholics. I know, look, I work with a lot of drug abusers and alcohol people break the law. In their brain, they know they're doing the wrong thing. They tell me, I go to prison, my family hates me. But when they do it, it feels so good that it overpowers the brain. So, do I think you're not smart enough? I would never say that. I think there's a mismatch between intellectual and emotional knowledge, and you need both to grow.
I see. Again, if I go to see you, does it mean that I don't have enough emotional knowledge?
No, it means that you need help, or you want help. You want to be different. And look, even if you come see me, I'm not sure that I can cure you. But I know one thing, I'm going to try my hardest. And if you don't do something different, things will always remain the same. So coming to me is hoping to be different. Again, remember, hope versus expectation. You hope to be different, and I'm with you. But if you only come with the expectation of me trying to cure you of all your ills, no one can do that. So, effects of therapy, research has shown actually almost 3/4 of people who come to therapy benefit, feel better. And symptom reduction means, if they come in with depression or anxiety, usually that lowers after coming to treatment, to therapy in particular. So the effects of therapy, usually you have a match between your feelings and your actions and your knowledge. So you genuinely can feel what you're doing is right instead of saying one thing and doing another thing. Like that example you told me about cheating. Saying to your spouse and to your kids, don't ever cheat, but then doing it anyway, well, that's a huge mismatch. You're sending two different messages. It's very confusing, not only for the partner or the kid, but for yourself. So if you want to feel more genuine to yourself, and honestly more like who you are and what you're doing, and not have that conflict, what I was talking about, then therapy usually helps you to recognize where the mismatches are. And what helps is having another person help you. And what makes therapy work is I'm not really involved in your life intimately on a personal day-to-day level. So I can have more objectivity. I can see you apart and not be so emotionally involved with you in that way.
So if I tell you something a secret, are you going to tell others?
That's one thing with the process. We're bound by something called confidentiality, which means we're not allowed to disclose anything in the treatment unless it's about hurting yourself or hurting other people, because that's when it becomes a safety issue. Usually people who want to hurt themselves or hurt the other people are not thinking in the right frame of mind, so we have a responsibility to report that. Other than that, it's confidential.
I see. Thank you.
Sure.